Rubeola, also known as measles or red measles, is a highly contagious upper respiratory tract infection caused by the paramyxovirus. It primarily affects children and is transmitted through inspired droplets, such as when an infected person coughs or sneezes. Once the virus enters the body, it undergoes an incubation period of 7 to 12 days, during which the infected person shows no signs or symptoms. After the incubation period, the early symptoms, known as the prodromal stage, begin to appear. These include fever, cough, runny nose, and red, watery eyes. As the disease progresses, a characteristic rash develops. The rash starts on the face and then spreads to the rest of the body. It typically appears as small, red spots that gradually merge together. Rubeola is highly contagious, and outbreaks can occur in communities where vaccination rates are low. It can spread rapidly from person to person, especially in crowded areas. Fortunately, measles can be prevented through vaccination. The measles vaccine is safe and effective, providing long-lasting immunity against the virus. To protect yourself and others from measles, make sure to stay informed about the disease and ensure you and your loved ones are up to date with vaccinations.
The reason why this guy's so contagious is that it's airborne, and spreads via tiny liquid particles that get flung into the air when someone sneezes or coughs, and can live for up to 2 hours in that airspace or nearby surfaces. If someone breathes in that air or touches a surface and then touches their eyes, their nose, or their mouth, they can become infected. Measles is so contagious that if one person has it, 90% of nearby non-immune people will also become infected.
What are some of the risk factors for getting measles? So the risk factors for getting measles include having a deficiency of vitamin A. Another risk factor is malnutrition, so this kind of ties in with vitamin A deficiency. Another one is being immunocompromised, so this makes sense. If you're immunocompromised, your immune system is low, or it's not as functional as it should be, you're more likely to become infected with
10 to 14 days from the time that the virus enters the body to the start of symptoms. And this is the incubation period. Once the symptoms start, we've entered the prodromal period, which typically lasts around 3 days and starts with a high fever and the 3 C's: cough, conjunctivitis or inflammation and redness of the white part of the eye, and coryza, swelling in the mucous membrane of the nose, essentially a stuffy nose. 1 to 2 days later comes the ananthem, which is a rash on the mucous membranes that looks like salt grains on a wet background. These are called Koplik spots and are these small white spots that are commonly seen on the inside of the cheeks opposite the molars. After these initial prodromal symptoms comes the exanthem phase, which is where a red, blotchy, maculopapular rash spreads in a cephalocaudal progression. In other words, the exanthem starts at the head, or cephalo, and spreads to the extremities, or the ends of the body, or caudal. This rash fades after about 4 days, and leads into the recovery phase, which can last for another 10 to 14 days, with the final symptom usually being a persistent cough. In general, infected people are most contagious starting from the final day of the incubation period through the prodromal and exanthem phase, which roughly works out to be 4 days before to 4 days after the onset of the rash. Now, the good news is that once all this is over and someone's recovered from measles, they have lifelong immunity. Since measles affects various organs like the lungs, the intestine, and the brain, it can lead to complications like pneumonia, diarrhea, and on rare occasions, encephalitis, all of which can lead to death. In addition, measles can suppress the immune system for up to 6 weeks, and this can contribute to bacterial superinfections like otitis media and bacterial pneumonia. All of these complications are worst among young infants, who typically have the highest rates of mortality during a measles outbreak. Another severe and often fatal complication for children under 2 years old is the development of subacute sclerosing panencephalitis, which can happen 7 to 10 years later. And this is thought to be caused by persistent measles virus infection, possibly due to an abnormal immune response or a mutated strain of the measles virus, which leads to chronic inflammation of the entire brain. The symptoms of SSPE are initially pretty subtle, like for example mood changes, but eventually become severe and dramatic, and can include seizures, coma, and if left untreated, death.